Hey everybody, today we're going to talk about acute low back and what we can do to help get you back onto your feet after you bend over, pick that pencil off the ground, and your back goes out.
Happens all the time.
Right. Now, let me pose a question at you. Is it really the weight of the pencil?
Probably not.
Probably not. More than likely, it's not a back problem. You don't have a bad back. More than likely, it's a movement problem, meaning that your body has accommodated to some sort of movement pattern over a long period of time, and bending over and picking that pencil off the ground was the straw that broke the camel's back.
Yeah, if you're thinking that, oh, I'm so tight and I'm so inflexible, and you just have been saying that for 10, 15, 20 years, eventually it's going to catch up to you. If you've got a pull coming on that low back from the front of the hips and the back of the hips, your body's going to find a way to get you down to that pencil. It's just going to pull from somewhere that you don't want it to.
That's right. So again, we're going to talk about the difference between a structural issue and a movement issue. Most of these scenarios are movement issues, and we need to teach our body pain-free, positive range of motion, and safe environments to move within so that our body knows it can move appropriately. So let's talk about the first one. The first one we're going to talk about is a structural issue. This is our spine right here, by the way. And by the way, this is Ryder down here. She's our emotional support dog, and she's hanging out with us today, letting us know that we're doing a great job. So thank you, Ryder. Appreciate you. So here's our spine here, and what we have here is we've got 5 lumbar vertebrae, we've got 12 thoracic vertebrae, we've got 7 in the cervical spine. The most mobile joints in the body, or actually in the spine, really sit down in the low spine itself and the upper spine, because that's where a lot of our movement takes place. So now, when we don't have an even distribution of movement through our spine, we're going to have lesions in either the upper part or the lower part, usually, right? So in this particular case, we've got an injury down here. This is our L3 to L4 disc space, and what a herniated disc is if you can imagine a jelly donut, right? And the jelly pops out the donut. There's your herniated disc. Now there's varying different degrees of this, right? Do you want to tell us a little bit about the different degrees?
Yeah, you can have the jelly out of the donut or a disc bulge going in all different directions. So you can have it to one side, which can be impinging on a nerve and irritating you down the leg. You can have right in the center, you can have it going into the central canal, which is where you want to look for all your red flag signs. So anything like bowel or bladder changes, if you're having night sweats, unable to find a comfortable position, those are the kind of things that you don't want to mess around with. You want to contact your physician right away. What else are they about? Yeah,
so there's various different degrees of herniated discs, right? And to be perfectly honest with you, when you get to my age, sort of her age, but my age, most of us are going to have a herniated disc. They're going to be asymptomatic from the disc itself, and the bending over, picking the pencil off the ground, creating a movement issue. You get an MRI, you might find a herniated disc, but more than likely it's not going to be the cause of your problem. And again, what Brittany was saying, if it's herniated into what we call the central canal, right, which is the inside part, and you have bowel and bladder dysfunction, a loss of a function of the leg, or night sweats, things of that nature, we're calling a timeout, and you're going straight to the physician at that point.
The disc bulge itself is not the part that's painful, so that's why Craig's saying when you look at an MRI, you can have disc bulges all over the place. It's what that disc bulge is impinging on that becomes painful.
Okay, so now let's transition that to what we call a movement problem, because a nerve impingement, when we talk about a nerve root impingement, what we can talk about is a disc hitting on the nerve root as it comes out of the spine, right? That's a possibility. Most of the time, however, the impingement is muscles that are over-contracted because they're compensating and they're trying to find a false sense of stability, right? A muscle spasm is a false stabilization process our body does to protect itself. And when that muscle goes into spasm, it contracts. And in the muscle, through the muscle, blood vessels, nerves, lymph systems, those structures, which are very painful, pain-sensitive structures, they get squeezed. So that can also be a pinched nerve, right?
Yeah, you can get that nerve pinched anywhere along the course of where it leaves the spine, all the way down through its course through the body.